Hi Elena, thanks for joining us today. Can you tell us why is it so many years after HIV and AIDS came to public attention, why are we still working on it? Why is it still an issue for women in the world?
If we look at the data that we have right now on from the UNAIDS, we clearly see the women and girls are particularly affected. The recently announced UNAIDS longitudinal study shows us a completely crisis, I would say, saying that new infections among young women, adolescent and girls can come up or comes up to 91% among young women, adolescent and girls. That's a status of crisis among women and girls in the context of HIV. The issues vary across contexts and countries, but unfortunately none of the countries achieve gender equality. And gender inequality is one of the underlying issues why women and girls are still affected. Of course, there is a biological susceptibility to HIV, but social and structural issues still dominate and continue influence how women and girls are able to prevent HIV, but also mitigate living with HIV and mitigate the impact of living with this disease. The discriminatory laws that are still persisting in many of the countries, so that needs to be removed, such as, for instance, laws that are not implemented against child marriage or absence of these laws. We need the HIV responses to go beyond just looking into the usual suspects, so to say, of addressing the gender aspects of HIV, like fighting gender-based violence. There should be more efforts towards more gender transformative interventions. There should be more budgets attached to the implementation of these interventions. We need to implement those evidence-based initiatives that have already proven their effectiveness, where men and women engage together and they collectively work on reducing, harmful gender norms and rate of violence, and that has outcomes for HIV as well.
What is it we as human women are doing and can do on this issue?
Young Woman employs governance approach to HIV issues, which implies ensuring the HIV response, starting from its very beginning, uses sex disaggregated data for gender analysis that informs HIV national plans and budgets to ensure that gender responsive actions and budgets are incorporated into the HIV national strategic plans. And the monitoring and evaluation frameworks include sex-disaggregated targets, so then we can monitor the progress towards women and girls in the context of HIV. And of course, the important pillar of this work is ensure that women and girls, both who are not living but also living with HIV, particularly given their everyday experience, are part of the HIV responses at every level.
Thank you very much, Elena.